policy researcher at RAND Europe, and I have a pleasure to talk with Antanas Montvila, who is the Vice President of the European Junior Doctors Association. We just had a session about health systems in crisis, and Antani, I would like to ask you, what are the major challenges that the young doctors are facing nowadays in Europe?
So thank you for having me here, and I'm really glad that I have the opportunity to represent the medical workforce and especially young doctors who are working across Europe. So I think this is overall the topic that's really broad, and we've been experiencing many challenges in Europe for many years now. Like when we look back to our policy papers, we've seen that a lot of things that we're discussing now, we've been already kind of trying to address 20 years ago. So for us, it's something that's kind of really long-term issue. So when we kind of been gathering through our GAs and meeting our colleagues across Europe, we kind of quickly realized that most of the problems actually are rather similar. And kind of we have that anecdotes around that we knew what's happening in most of our countries, that we are really understaffed, we're really underfunded, underprepared, like not being supported in our training. So we thought, okay, let's do that kind of extensive research and try to understand the actual situation, because we had that power as an organization to go to the countries and understand the situation on the ground better. So we finalized our study, which is called From Tradition to Transition, Navigating Through Medical Workforce Crisis. That's going to be released by the end of October. So we kind of learned several major trends that I guess junior doctors are experiencing across Europe. So of course, as expected, there is a great dissatisfaction at workplace, and I think this is heavily related with the payment doesn't match the current situation, economical situation. Of course, there's great problems with the working conditions overall. So even working hours and all these things that kind of needs to be addressed separately, but also kind of seeing that there is a great burden of work. People feel like really overworked, and the demand is increasing all the time. And from personal perspective, as I mentioned during the panel, since the COVID start till now, we feel that the case loads during the night are increasing or doubling, but we have the same workforce. So this is kind of becoming an environment that is not safe either for medical professionals and patients. However, these are kind of things that you can more or less expect, because these are the problems that we are mainly talking about. But we identified several really disturbing and disturbingly kind of consistent trends across the geographies of Europe, that what we call the massive resignation of profession, when we're not even calling that going for other specialty or going from public to private, but people decide to leave medical profession and not to work as medical doctor anymore, which is, I think, creates other great pressure and builds on the demand we already have. And of course, there are great problems related to the lack of flexibility, cultural problems. We still not reflect, I think, the dramatically changing landscape in terms of gender. The medical profession becomes more and more represented by women population that needs to take more time and flexibility to other caring for family or other members of family. So I think we also need to understand the kind of, as we call it, social fabric that's dramatically changing. So I think these are the key problems that we mainly kind of identified and aiming to kind of speak about more, because usually we kind of end up with discussions when we discuss about the lack of number of people we want to have. But I think as we all agree as well with our organization, that the new reality is that we have the number of people we have. We will not have more doctors. We will need to adapt to that number, not adapt, not increase the number to adapt to the failing system, but adapt to the amount of people we have. And if we're lucky, we'll have similar numbers, but likely people will tend to leave the profession just because of the silent kind of protest and not being recognized as a care provider, but rather being seen as a service provider. So there are very complex issues as we see.
Mm-hmm. do you have any advice for the policymakers how to address the situation?
Yeah, so I think it's quite easy to provide advices in discussion level. However, I think what we also agree quite substantially that you need to be aware about the money and how money is flowing in the system, because currently what we see is that current financing system of healthcare in many European countries are solely based on service provision. That's basically fee for service. If you look like for DRGs, even the capitation, it kind of makes healthcare services to orientate the service provision, not caring of people. So I think this is kind of one of the biggest kind of challenges that we need to address if we want to kind of substantially address this problem. Also, I think it's worth mentioning that currently we still kind of providing care and speak about healthcare systems as something that was popular in 60s or 70s, when everything was based on, oh, let's treat the disease, and we were not calculating in the aging population, the increasing number of non-communicable diseases, and what kind of pressure they create when they come always to the medical system for like really simple solutions. And I think these other, and also like we have like, we see that we need to deal with that migration of medical professionals across like sectors and even leaving that, which is I guess more as a symptom rather than actual kind of core of the issues we're talking about today.
And finally, I was wondering if there's any hopeful examples you could name in any European countries that you would suggest as something to follow for others to address at least a fraction of the problems of the junior doctors?
So I think this is kind of a very good question in terms of that when we get that question and you need to think about, it means that we're really not in a very positive situation. Of course, there are some examples, like I would maybe call like Germany, who are kind of more or less trying to build their system or junior doctors training more or less following the European Working Time Directive. Because if you look to more to our southern members and colleagues, you would quickly learn that they work like 70, 80 hours, or even my country, like many trainees just to make a living. They have one job that follows the regulation, but then when you go to the other hospital after your free time, then nobody knows how many hours you work. But it's not because like you want to work, because you need to pay the bills. So I think there are also what we see currently, maybe not like concrete example, but this more like European movement, because thanks to COVID maybe, that we have this tiny gap when we still have the spotlight on the topic, and we can have more or less cooperation and discussions in these high-level events and spot the light on the issues. And I think maybe also what's worth mentioning, that as an association we kind of also maybe shifted a bit our work and identified that all of the people are facing very similar problems that at first glance might look very different. So we believe that putting all us together and trying to find a bit more like unified European approach might help us to address these. And I think one of the examples that from our organization is that we will have an extensive 2 days workshop together with WHO Europe, where we bring members from our organization to learn and work together with experts in the topics, starting from financing, retention of medical workforce, as well like digitalization, and to try together discuss what are the most pressing problems in their countries, and just to help them, equip them with better skills and understanding where they can act on the local level. So I would say it's not something concrete yet, but we believe that only through these kind of joint activities we can equip our members to act more precise and address the right targets in their countries.
Thanks, Antani. All the best with your work.
Thanks very much, and good luck.
Thanks.